So for next, we are trying to focus on Enterobius vermicularis infestations in girls. Okay, so this is Enterobius vermicularis. It's something that is of great importance, and you see it a lot in microbiology. Okay, but we're not trying to talk about like if it actually occurs in girls. Okay, what would be the issues? So what we have here for this Enterobius vermicularis infection in girls is you should know that it's commonly known as pinworm. It's a parasitic worm. It causes what? Enterobiasis. Okay, you see how the anus is scratchy, right? So it's a highly contagious intestinal infection. It's especially common in young children, including girls. Okay, so we are mostly focusing on girls because this channel is basically for what? Obstetrics and gynecology, also pediatrics. So understanding the infestation, transmission is usually the fecal-oral route of infection transfer. So eggs are laid, okay, around the anus. Okay, so the person defecates maybe around the water bodies. Okay, other people still use the same water to water vegetables. A lot of complications, right? So this is a life cycle which I won't discuss because I will discuss that in microbiology. You can pause to observe it. So symptoms in girls: there's intense anal itching. You can notice that here. Intense anal itching, restlessness or disturbed sleep. They are irritable, so any small thing is making them angry. Okay, because the whole body is not really on the well-being side. Vaginal itching or discharge, and sometimes you can actually see visible worms. Visible worms where you try to like do a microscopy. Okay, so diagnosis is tape test, visual inspection. You can just clearly see that worms on the skin around the anus or the stool. And sometimes if the vagina or the vulva becomes inflamed, you can actually do a swab. Okay, so treatment is you're actually dealing with a parasite, so you use anti-parasitic medications. So mebendazole, albendazole, parenteral palmate. So usually a single dose should help. Okay, repeated in 2 weeks. So you also treat all household members as we are treating the child. Okay.